Hey guys, let's talk about this blood test for colon cancer that's just been approved by the FDA. So colon cancer is the second leading cancer killer in the US. It's the third most common cancer among men and women in Canada. Really important cancer, and we have a great screening test for it that works really well, and that's colonoscopy. With colonoscopy, the benefit is not only can you pick up early cancer, where you can do something about it when you pick it up, but you can also detect precancerous polyps before it ever becomes cancer, and you can remove those polyps while you're in there. So it's not only screening, but it's also treatment or taking action while you're doing the colonoscopy. Now, the reason we have all sorts of other screening tests like fecal occult blood tests or fecal immunochemical tests, basically tests that look for blood in the stool or look for pieces of cancer DNA in the stool, is that only about 60% of people who should be getting colonoscopy actually end up getting it. So this new blood test is yet another tool we have in our toolkit to help detect colon cancer early. It's not a perfect test. This was the study that was published around it, if you're interested in looking at it. The test works pretty well, but it did miss 17% of colon cancer cases. It is really not good for precancerous lesions. It missed 85% of precancerous polyps. In about 10% of cases, it was positive, but there was no cancer, so it's a false positive. Those people ended up needing a colonoscopy and not having anything on that colonoscopy. That's not such a big deal because they would have anyways needed a colonoscopy for screening, but it's the 17% false negative that worries me. So it's great that we have a reasonably accurate blood test, which is a really easy thing to do. It's going to be marketed for $900 in the US. Let's see if it gets approved in Canada as well, and if it becomes available and at what price. But the bottom line is that the best test to detect colon cancer remains colonoscopy.